Daniel, how are you, sir?
Hey.
Dr. Phil.
Hey, Dr. Phil.
Very nice to meet you. Go ahead and have a seat for me. So I wanted to thank you for filling out all the paperwork. I know it's kind of tedious, but wanted to thank you for doing that. I saw you were a referral from Luke. Is that right?
Yes.
Cool. I love Luke. He's a great guy. We've taken really good care of him, and so one of the ways that we get patients and the ways that we like to spread the word about chiropractic is through our patients. And so if you feel that we've taken great care of you, then by all means go ahead and spread the word for us. All right.
Okay.
Cool. So before we get started with all the exam procedures and whatnot, and kind of diagnosing you, what I like to do is take a little bit of time and kind of explain to you what it is I do as a chiropractor and how that's going to relate to you, and just so you know that, just so you know what I'm doing and what I'm trying to accomplish. So
Okay.
would that be all right?
Yeah, that's fine.
Okay. So excuse me. So what I do as a chiropractor is I care for the nervous system. The nervous system is how your brain communicates with your body. Okay. So here I have a dry spine. This is how your spine looks. So here you have your spinal column, all right, and then encased in that spinal column is what we call your spinal cord. Your spinal cord is like the main highway between your brain and your body and communicating that, okay? So up here, this would be your neck, okay? So your neck basically has all these nerves coming out of it right here, okay? And those are going to go to your upper extremities, like your arms. And then here is going to be your mid back, so that's going to be everything in here, so ribs and heart and lungs and those kind of things. And then down here on your low back, excuse me, what you have is all your leg nerves. So everything that's going to be, talking to basically your lower extremity and your gut. So, and you have two kinds of nerves. One is sensory, so everything that you're touching, and everything that you use for muscles, for movement. Okay, and another thing that you also have is nerves that talk to organs as well. So you have, for instance, in your upper back right here, you have nerves that talk both to your heart and your lungs. So as a chiropractor, I treat the entire spine. So a lot of times people will come in complaining of like low back pain or something, but because I'm treating the entire spine, they'll have symptom relief of other things, such as their blood pressure will get better, or their asthma will get better, those kinds of things. Okay? And so what I do as a chiropractor is I treat what we call subluxation. And the subluxation is basically any kind of interference to the nervous system. So you get this by having poor posture, being in a trauma, accident, not having the right diet, those kinds of things. And so basically what I do is I go through on the spine and basically clear the way for the nervous system. So a subluxation, you can imagine, is kind of like a big traffic jam. A highway that's jammed is not efficient. It doesn't communicate. It doesn't allow anything to go through it. What I do is I clear that accident or that traffic jam, and I allow for proper flow of the nervous system so that your body can function the way it's supposed to. Now, subluxation can happen anytime. You can happen from childbirth on until you leave the earth. And excuse me. And so sorry, I'm losing my train of thought here. And so basically what I do is go through and help remove that. Now, a lot of times subluxations will be asymptomatic. So just because your chief complaint might, go down, maybe you're in pain right now, and maybe that goes down during treatment. That's fine, but that also doesn't mean that you're necessarily fully healthy. And so I'll be definitely working with you as far as the treatment plan goes and figure out a way to get you in that spot, okay?
Okay.
And so basically the way this is going to work is that when today we'll be doing an exam procedure, so I'll go through, I'm going to examine you from head to toe, and we're going to come up with what's called a report of findings. So today I'm gonna get all this information, and tonight I'm gonna put it all together into a form that's called the report of findings, and then tomorrow you'll come back and I'll give that to you, and we'll go through it and kind of figure out exactly what it is you need.
Okay.
So if you have any other questions, we can go ahead and get started on our
Sure.